Hello, students. This is Professor Lopez, and we are back with a new antibiotic series where we are going to target the most tested upon antibiotics, not only for your nursing school exams, but for your NCLEX. We are going to kick this off with tetracycline antibiotics, and we're going to go over the main subcategories, such as how to identify this medication on an exam, what are some specific indications, mechanism of actions, and some very key points for examination purposes. As always, if you enjoy content such as this, feel free to like and subscribe as I will be putting out a lot more antibiotic videos in the future. So, tetracyclines. We're going to start off with how to identify a tetracycline on an exam. Like other antibiotics, tetracyclines are very forgiving in the sense that they all end in the suffix cycline. The same way it's in the name tetracycline, all the drugs in this subcategory end in that cycline suffix. Whether the drug is doxycycline, tigacycline, monocycline, these are all tetracycline antibiotics. And if you can identify that suffix on an exam, you can correlate the other things we're talking about this video to that question. Now that we can identify what this drug looks like on paper on an actual medication label, how does this medication achieve its therapeutic effect? Your tetracycline antibiotics are a bacteriostatic antibiotic that targets specifically both gram-positive and gram-negative bacteria by inhibiting protein synthesis. By inhibiting protein synthesis, this eventually leads to cellular death and resolution of the patient's signs and symptoms. Now, why tetracyclines over other antibiotic classes? Indications for this disease process and very key points for examination purposes is this is a drug of choice for acne, for STDs such as chlamydia and gonorrhea, and one of the big outliers is Lyme disease. I want you to outline and bold out Lyme disease, as Lyme disease is a vector borne illness that exams such as NCLEX love to target. The antibiotic of choice in the tetracycline class for Lyme disease is doxycycline. So make that correlation that doxycycline is the antibiotic of choice for Lyme disease. We're going to move on now to side effects. Side effects are a very big target for select all that apply questions. So make sure you can target the main key side effects for your tetracyclines. I have narrowed this down to four main side effects. Now, again, these aren't all the side effects, but these are some of the outliers that specifically are related to tetracyclines. The first and paramount side effect that is specific to tetracyclines is the potential for teeth discoloration. Because of the high affinity of calcium, this drug can alter the color of the patient's teeth, specifically if they fall in the following criteria. If they are under the age of 8, and if they are breastfeeding and a lactating mother. That is because remember, milk that is transferred into the baby's mouth does contain to some degree some contents of the tetracycline. So beware for your children under 8 and your pregnant woman, as this can cause teeth discoloration. Number two, there is a high risk for fetal harm, so this medication is not recommended for the pregnant population, as tetracycline and its affinity for calcium can cause great issues with the skeletal development for the fetus while they are in utero. Number three is C. diff, the infection of the GI tract that specifically leads to things such as large bouts and very frequent and foul smelling diarrhea. This can also be referred to on exams as pseudomembranous colitis. So alert your patients to contact medical providers if they do have frequent and foul smelling diarrheas while on tetracyclines. And the fourth and final side effects we're going to talk about here is the presence of photosensitivity. Because of tetracyclines and their presence of photosensitivity, it is very important as a nurse that you understand to alert your patients to apply protective clothing and sunblock if they are in need of getting outside exposure. So, again, photosensitivity is counteracted with sunblock and protective clothing in the patient population. So, to round up everything that we talked about into a very digestible and nice bullet points for you and your upcoming exam, some key points to add to your notes and assist you in getting that A that you deserve include number one, While taking tetracyclines, you need to avoid dairy products, antacids, and iron salts. These are three things that greatly impair the absorption of tetracycline. So, again, avoid dairy, antacids, and iron salts. Number two, tetracyclines do reduce the effectivity of oral contraceptive methods. So, if your patient is taking a combination birth control or any type of oral medications for birth control, you need to alert them on the necessity for barrier methods to reduce the incidence of pregnancy. Number three, after taking this medication, your patient is to sit upright for at least 30 minutes, as tetracyclines are associated with esophagitis, meaning that there is to some degree reflux of acid from the stomach that can erode the airway. So instruct your patients, sit upright for at least 30 minutes after your medication. And lastly, underline and highlight this one. Under the age of 8 and your pregnant lactating woman, please beware of teeth discoloration. With all of these key points and information, guys, make sure you take adequate notes and you will for sure be able to answer any questions or select all applies for tetracyclines.